We have been trained for disasters. We have been trained for pandemics. We've been trained to see any kind of emergency that comes our way. That's what we signed up to do.
We had heard about the COVID-19 virus in China. So we were aware that there was a potential disease that could be coming our way.
It's this invisible foe that you're trying to engage, but you have no idea exactly when it's going to strike, how it's going to strike, and what you can do to protect yourself.
So the first thing was to set up the command center, which served and continues to serve actually as an excellent vehicle for communication, collaboration, raising issues.
And we started to prepare for what we didn't know. And we all came together truly as a team to how are we, John Muir Health, as a system, going to make sure that we are prepared for whatever might be coming our way.
The crisis came upon us rather suddenly, but it didn't catch John Muir leadership completely off guard.
We learned that we had a lot to learn and that we needed to do things differently and that we needed to do things rapidly and we needed to be nimble in making decisions.
As I reflect back on the fear in the early days of this, my greatest fear, and I believe the greatest fear of the whole leadership team, was, will we have what we need to protect our frontline caregivers?
It's not only to protect us from contracting COVID, but it's also to protect our patients and our staff.
Heart attacks didn't stop during the pandemic. People in pain didn't stop during the pandemic. So we had to make sure that we were safe and able to take care of those patients as well.
In the urgent care center, they divided us into two separate wings so that we could continue seeing patients in the standard urgent care side. But then we had a separate wing that was labeled the respiratory urgent care center.
One of the examples that we learned about the use of very, very long IV tubing. So it didn't require a nurse to doff and don different PPE every time she or he had to go in and adjust the IV drips. They could do it from outside the room. Same thing can happen with the respiratory therapist. They can make adjustments in the ventilator from outside of the room. It's pretty ingenious.
I feel it's one of our proudest accomplishments is that we worked very, very hard to make sure that we had what we needed and were following the strictest guidelines to protect our teams.
The unsung heroes of this whole situation, of the coronavirus pandemic, are the lab workers, the radiology techs, all of the ancillary staff members. They have been extremely invaluable.
And the first people that I thought of were my triage nurse, my greeter, our security guard, as they were there dutifully every day, doing their job, accepting patients, even while we knew the risk was high.
Even to this day, when I go up onto these COVID units, these warriors are unbelievable. There is an energy, and there is a passion, and there is a commitment to these patients that is indescribable.
I truly believe that we did such a great job here at John Muir to prepare for a surge in cases, but I also feel all that preparation also helped prevent spread.
Because we had a common goal, we had a common mission, and that was to do what needed to be done to be able to provide care.
This is who we are. This is every single person who says, I am John Muir Health.
I never foresaw anything like the current coronavirus pandemic, but I'm extremely honored and privileged to be here, to be able to serve my community.